Retrieval Based Learning, Transforming Allied Health Education by Jessica Edwards. After the completion of this presentation, you will be able to perform the following. Discuss the retrieval-based learning and the impact it has on the learning process. Analyze your classroom activities and incorporate retrieval activities. Understand the effect we have on students entering the workforce. Educate students on effective study techniques. Incorporate spaced retrieval into your classroom learning opportunities. As allied health students, learning new knowledge or a skill can be a daunting task and take a tremendous amount of time. As professors, we should investigate various methods to increase the efficiency of learning. There is no magical equation for learning material quickly. However, implementing a few small changes in the classroom and educating our students on effective study habits, we can help ease the burden. We often think of learning as the process of increasing the student's intellect. We stand in front of a classroom, lecturing, while the students feverishly write down all the information they can, hoping not to miss anything valuable. The day before the big test, the students read and reread the information in hopes to ingrain the knowledge into our minds. An even more effective method would be for the students to try to recall the information on their own. This is known as retrieval-based learning and is widely underused. Retrieval is the process of recovering knowledge or information from long-term memory. The more a student practices retrieving knowledge, the stronger that connection becomes, thus improving how easily the information can be reached. In fact, with every active retrieval, there is some change that occurs that improves the student's ability to retrieve and recreate that knowledge in the future. The learned knowledge can then be used to solve other similar problems. Retrieval is done through memory or retrieval cues that activate knowledge from long-term memory. These cues unlock the information and give a student the ability to retrieve the information in the future. Mass cramming does not form the cues needed for sustained memory retention of information. In the medical field, we often have to retrieve information quickly and under tremendous stressful situations. The stronger the retrieval cue, the more effectively and effortlessly one can recall the information. Retrieval practice has benefits on multiple levels. First and foremost, it helps the students learn more efficiently and retain that information for the future use. Recalling information actually improves the student's ability to apply that information to new situations. Retrieval practice gives the student instant feedback and allows them to identify what they do not know. If students know where they are lacking, they can direct the focus of their future study sessions. It can also ease test anxiety by promoting test expectancy. Students will pay closer attention to the material when they know what is to be expected when studying. Benefits extend beyond students. Frequent testing and retrieval gives the teacher an idea of how well the class as a whole grasps the concepts. If there are a few students who are struggling, individual attention can be given and thus not hold the entire class behind. If the majority of the class is not understanding, then we can change how we deliver the information. The ultimate goal of teaching and studying is to have information transferred into long-term memory and to be able to make the connection to use in future situations. Retrieval-based learning focuses on recalling information from long-term memory by performing retrieval practice techniques. Retrieval practice is an active state of learning that strengthens the connection between memory cues and the information. It involves repeatedly recalling information across multiple study sessions and recall sessions. The timing of retrieval practice is crucial to the learning process. Combining spaced retrieval can multiply the effects of retrieval-based learning exponentially. The greater the amount of time between retrieval events, the greater the potential benefit to retention. Spacing out sessions over a period of time promotes deeper processing of the learned material. The amount of time between sessions is not set in stone. However, it works best if spaced out over a period of at least 24 hours. Also, you do not have to stick to the same type of retrieval practice. Incorporating spaced quizzes, thinking games, or other activities allows students to learn from different styles, helps them recall information, improves retention, and keeps them focused. Allied health jobs often require remembering a huge amount of information. No matter what field a student is in, they will be required to quickly recall upon information learned during their education. Because they used retrieval based learning, they can rapidly make the connection and provide swift decision making when there is no time to call upon a colleague or to conduct research. There is often a stigma assigned to new graduates in the allied health settings. Employers want professionals who have experience and can perform their skill with minimal supervision and interruption. Having the ability to retrieve information quickly can improve a student's confidence and better prepare them for the workforce. Implementing changes to your classroom time to include retrieval learning activities does not have to completely uproot your plan. Any opportunity a student has to recall knowledge is considered retrieval activity. During lecture, it can be as simple as pausing to provide questions for the students to answer out loud. You could also incorporate a lab to demonstrate the discussed material. This helps students learn through multiple channels and further cements the information into the memory. Ask students why they chose the answer they did and attempt to relate it to previously learned material. Frequent quizzing throughout a lesson plan can also help improve retention and provide you with feedback. No matter what method or methods you choose, allowing the students time to process the information and then recalling it is an important step in the learning process. There are many specific changes that we can make in the classroom setting. One of the hardest things for an allied health student to do is memorize all of the information that goes along with anatomy and physiology class. The information taught in this class is the foundation of our knowledge as a healthcare provider, and it is relied on daily. How we structure our classroom time can help tremendously. Break up the lecture time by incorporating fill-in-the-blank diagrams from memory, or use mnemonics to relate material. In many situations, you can have the students use clickers or whiteboards to answer open-ended questions. Provide the students with online flashcards or games to promote recall, or switch roles, let the student be the instructor by having them teach the material in small groups. Making changes can be overwhelming, but if we can make at least one change, incorporating short, low-stakes quizzing can greatly improve the learning process. These quizzes can start with a pretest to evaluate what the student currently knows, and then continue with frequent quizzing at each class meeting. This allows both you and the student to know how well they are comprehending material and help direct future classes and study time. Being an allied health student requires a great amount of time outside of class for studying. Making changes in the classroom is not the only area we can help students. As professors, we must educate our students on the importance of effective study techniques. If students spend their time outside of class reading and rereading material and cramming information into their brains, when they come into the class, they will have retained nothing more. Encourage students to use flashcards, blank diagrams, or other tools that require them to recall information without assistance. Discourage cramming the night before the test. Instead, urge students to divide the study time into shorter, more productive learning sessions. When studying in groups, have one student teach the others the material, but above all else, encourage students to get plenty of sleep. There is a great deal of memorizing required as an allied health student, which results in frustration and late-night cramming sessions. As students become clinicians, they rely on their education and the knowledge they gained and must recall such basic knowledge on a daily basis. It is vitally important that they are able to retain and recall the information at a much later date. The information they retain and recall can be the difference in the type of treatment we use or don't use, Give them the ability to determine which medication has what side effects, or what type of activities can help improve their patient's ability to function. Changing a few aspects of our classroom learning can greatly improve the clinicians they become in the future. Providing a positive and effective learning environment is the most important role we have as allied health professors. If we do not place as much emphasis on performance testing and instead focus on retrieval as a part of learning, students can improve their level of retention and acquire higher order reasoning skills. Both of these skills will give them a solid start when entering the workforce.